It's the rainy season, and med school in the times of the pandemic is really so stressful. These two make us all crave our favorite food, don't they? Be careful though to ensure that your food is properly prepared and cooked. Otherwise, you will end up with a bowl full of worm instead of noodles. This reminder is timely as our lecture series is all about parasitic helminthic infections. Just a quick overview on where we are. On the mega chapter on pediatric infectious diseases, you already had lectures on the bacteria, and today's section is the second part. Our objectives for this afternoon are: if you had aced parasitology in second year, the lectures would certainly be a breeze for you. Think of it as a review with a little bit of a Pedia twist. These organisms should either bring back good memories or give you butterflies. I know that you're anxious about online learning, and so are we as teachers. But I believe perception changes everything, and I also think that the same applies to med school when we play computer games, or we watch YouTube, or we watch TikTok. So we engage, we make time for it, we give it our full attention, and we are excited by it. So today, think of this lecture as if it were a stage in a challenging game, and your motivation is to achieve that high score in the end. Are you ready? Let's have a short pre-test. Oh no, wait, let's call it Paligsahang Parasitiko. Corny ba? Well, cheesy is the new saucy. So we'd like to entice your interest in today's lecture. So be it. I will read out the questions and the choices, and you can jot down your answers on a piece of paper. The answers will be revealed after the lecture. The first question goes: the most prevalent human helminthiasis that produces an estimated 1 billion of cases worldwide is... Next question. All of the following helminth infections can produce respiratory symptoms, otherwise known as Loeffler's-like syndrome during their larval stages. Question number 3. The official scientific name for the human threadworm is... Question number 4. A picture question. Which of the following microscopic slides represent a Trichuriasis egg? Question number 5. A level up question. The problem reads: a 3-year-old girl who was previously healthy presents with a 1-week history of intense nocturnal perianal itching after residing in a different household. The cousins in that house also had the same symptoms, and bruxism was observed to occur during her sleep. There are no other findings. The PE is normal. What is the treatment? Is it... What was your answer? Jot it all down. Last question. Question number 6. Another level up question. An 8-year-old boy from Makati received a liver transplant 6 months ago abroad and is on corticosteroids and azathioprine. He presents in the ER with a 2-day history of cough and wheezing. Hemoptysis was observed within the last 12 hours. A stool specimen is most likely to reveal what? In the Philippines, more than half of all school-aged children harbor soil-transmitted helminths, and this is mirrored by worldwide statistics as well. Majority of affected children are in the 1 to 5 years old age group. Hence, the Philippine law mandates and health agencies actively implement effective drug treatment, behavior-changing approaches, and the so-called WASH, or WASH, the acronym which means Water, Sanitation, and Hygiene. These administrative orders mandates the twice-yearly routine deworming for all children and special groups. If there is one dosage of medications you must remember, and we don't really necessarily like memorizing numbers, it is this. Preventive deworming is done with any of the following benzimidazoles, either albendazole or mebendazole. With mebendazole, it is easy. The 500 milligrams is given to patients 1 year and up, whereas albendazole requires half the standard dose if it is to be administered from ages 1 to 2. There are contraindications, however, to deworming. You cannot give it if your patient is suffering from 1. Severe malnutrition, 2. High-grade fever, 3. Profuse diarrhea, or 4. Abdominal pain. And it is easy to understand why helminths are so prevalent in children. Due to their developmental immaturity, infants like to crawl. Children have a hand-to-mouth habit, and pica is common. And they have less regard for protective measures and hygiene. Add up to it the factors of poor sanitary conditions and poverty, the equation is now complete. The most famous champion of all the helminths that affect billions of the world's population is Ascaris lumbricoides. Ascariasis is the most common form of parasitism in the Philippines and even worldwide. Its synonyms are as follows. Ascaris is transmitted by the ingestion of the fertilized eggs. When ingested, these are transmitted and released into the intestines, where they penetrate the venous circulation, making its way into the lungs. Here it causes the Loeffler syndrome-like symptoms of cough and dyspnea, wheezing, pulmonary infiltrates by X-ray, and eosinophilia. From the alveoli, the larvae will migrate up into the bronchi and trachea and are later coughed up. Some of them are swallowed back. They return into the intestines to develop into adult worms. Because these worms are large, they can cause significant obstruction and even intestinal perforation. The adult worms can actually even travel into the biliary and pancreatic tract, especially when they are stressed, like when the host has a fever or other illness. Diagnosis of Ascariasis is very simple, by stool exam and using a simple light microscope. Which of the following illustrations is the Ascaris egg? Is your answer C or G? Then both of your answers are correct because these represent Ascaris eggs. Letter G is the unembryonated version. The rest of the other parasites, which will serve as a review, letter A is Schistosoma hematobium, B is Schistosoma japonicum, D is Paragonimus westermani, E Schistosoma mansoni, F Fasciola hepatica. And this is how the adults like grossly. If a patient with intestinal obstruction who is highly suspicious for Ascaris undergoes a flat plate or barium contrast X-ray, what will be seen is the so-called tramway sign or railroad sign, spaghetti, or dot sign. So in this illustration, it is easy to see the tracks of the Ascaris adult worms that are providing that contrast appearance. And there is some sort of obstruction already. Here we see the dot or string signs. Please note that throughout our lecture, the reference for treatment is a Nelson's textbook of pediatrics. Please be assured we will not ask doses of medications in the quiz or the exams, at least for my lecture. That being said, we kill Ascaris worms by giving our patient oral albendazoles. And additional piperazine citrate can be an option in cases of huge parasitic loads because this promotes rapid expulsion of the worms and promotes neuromuscular paralysis. In cases of severe obstruction, sometimes surgery may be necessary. Certainly, we can say that the Ascaris can attempt to outwit and outplay its human host by affecting many of the world's population, by living quite long, and by being prolific egg layers at such an early age. In an entire lifetime, an Ascaris can lay as much as 26 million eggs that remain viable even in refrigerated areas for as long as 2 years. Hence, appropriate treatment must be given and safe water, sanitation, and hygiene implemented. Let's ensure that our farmers also avoid the use of organic human fecal fertilizer, aka night soil. We are fascinated by vampires. The helminth world has its counterpart. In this, we see the blood-sucking hookworms and how they tenaciously hold on to their victims even at the point of death. Which brings us to our second topic, hookworm infections. Classic human hookworm infections are caused by Necator and Ancylostoma duodenale. And the less common animal hookworm species are as follows, but they usually cause major pathologies in animal specimens. We remember that hookworm eggs hatch into either rhabditiform or free-living larvae or the filariform larvae. It is the filariform version that is responsible for penetrating into the skin of the unsuspecting barefoot shoeless victim, causing a ground itch. It is a burning, pruritic vesicle persisting for 1 to 2 weeks. Further on, the larvae will travel into the circulation until it reaches the lungs, causing pulmonary symptoms similar to the Ascariasis Loeffler's-like syndrome. These larvae are expectorated or coughed up and swallowed again back into the intestines, where they grow into adults and cause the hookworm disease if the worm burden is significant. Due to the attachment of the hookworm with its cutting teeth and plates against the intestinal mucosa, anticoagulants are secreted, allowing for free flow of blood and loss of plasma ingested by the worms and lost in the stool. Worm burden is proportional to the symptoms. Blood loss is 0.2 ml per worm per day in the Necator and less for the Ancylostoma. Diagnosis is made by identification of the characteristic eggs in the stool, and treatment is by the drug of choice, albendazole. These are the alternatives. Take note that in this type of organism, there has been an emergence of anti-helminthic drug-resistant Necator americanus. So, that adaptation is not only limited to bacteria and viruses. Is it necessary to replace our anemia and blood loss with oral iron? References will say it is not needed for as long as the worm population is killed off. The symptoms shall also be resolved. Hookworms, just like their Ascaris friends, are prolific egg layers, as much as 25 to 30,000 per worm per day. And take note, there is one clinically standout finding among patients who suffer from anemia caused by hookworm disease, chlorosis. It is a greenish tinge that overlaps with the picture of anemia. So literally and figuratively, they look green. In summary of level 2, hookworm infections are treated with albendazole, and measures to control their propagation include the wash, regular, scheduled, and preventive deworming, and the use of shoes and slippers. Remember that the portal of entry of the filariform larva is through breaks in the skin. And humans are their incidental hosts. The Ancylostoma brasiliense causes a form of cutaneous larva migrans, whereas the dog hookworm larva causes eosinophilic enteritis. Take note, these organisms never have a chance to develop into adults in the human host. Only the larva cause the pathology indicated here. Let us mention for a little while CLM or cutaneous larva migrans. The creeping eruption, otherwise known by the following common terms, is actually the lateral larval migration of the organism on the patient's skin, causing serpiginous tracts. They're very itchy, and there are varieties of their clinical manifestations. The treatments are quite hard to find, including the ivermectin and thiabendazole, but in that case, albendazole is available in our country. This illustration shows the serpiginous pattern of the lateral movement of the larva over here. Take note that the variety in the speed, the appearance, and the complications of the cutaneous larva migrans can point out to the etiology. Perhaps the most noteworthy organism in this slide is the Strongyloidiasis, which causes the larva currents. The movement is very fast as opposed to the rest, which are slower. Again, the life cycle of these animal hookworms are completed in the animals themselves that cause that cycle of anemia and other hookworm diseases. If, however, incidentally the human becomes the host, restricted symptoms are observed, most particularly cutaneous ones, hence the cutaneous larva migrans. Has anyone ever told you you are the sprinkles to my cupcake and showed you this picture? You would think differently of that person once you know this is actually a picture of a rectal prolapse, which is usually associated with Trichuriasis infections. Children with heavy infections experience chronic dysentery, rectal prolapse, anemia, and weak growth. The illustration here is not a puckered lip, but actually the rectal prolapse itself. The trichuria egg is probably the easiest to identify on light microscopy because of the egg's bioperculated appearance. So this egg, embryonated, upon ingestion, hatches in the small intestines, and later the adults will usually reside in the large intestines, especially in the cecum. The effect of the Trichuriasis infection is pronounced in children with heavy infections, where they experience chronic dysentery, rectal prolapse, anemia, and poor growth. Its ability to cause anemia is because the worms suck blood. Not as much as hookworms, but this can be significant in high burden of worms. The prolific females also lay many eggs per day and can be transmitted easily through inanimate objects or flies and other insects. The drug of choice for treatment of trichuriasis is mebendazole, which is safe and effective in part because it is poorly absorbed by the gastrointestinal tract. It reduces the egg output by 90 to 99% and has cure rates of 70 to 90%. Regarding albendazole, in heavy infections, unlike mebendazole that can be given as a single dose, albendazole may have to be given for 3 days. In summary, level 3, trichuria, is treated with mebendazole, and we can prevent this by, again, practicing the wash and restriction of the use of night soil or using human fecal matter as fertilizers. If you live in the US and think you are spared from the ills of the third world with regards to parasitism, think again. Enterobiasis or Ascariasis is actually the most common helminth infection in the United States. It is said to transcend socioeconomic status as it is most common in whites, even surpassing the data in people of color. Serious illness. Adult female pinworms migrate to the anal region at night to lay eggs. Hence, symptoms are by mechanical stimulation and irritation, and allergic reactions, and migration of the worms to anatomic sites where they aren't supposed to be. They become pathogenic. The Enterobius infection has often been associated with a concomitant Entamoeba fragilis infection, which does cause diarrhea. Diagnosis is by finding the adult female worms in the patient's anus, but not in fecal smears. Females are pretty smart because they have a sense of time and navigational skills. Before even taking a bath or wiping the anus, a tape is placed on the perianal region in the morning of the examination. Ova are detected, and this technique is called the Scotch tape method. Another name for it is the Graham's method, which is illustrated here. Treatment is via oral mebendazole, and here are the alternatives. We must ensure that the entire household is treated with the same and repeated after 2 weeks because there might still be viable eggs in the environment and can reinfect our patients. Encourage your patients to bathe in the morning. This removes a significant amount of eggs. It's all in a night's work, so to say, laying 15,000 eggs in a single night. Those eggs are going to live for as long as 20 days. Level 4 complete. Enterobius vermicularis, which is treated with mebendazole in all the members of the family and the household, and repeat treatment is necessary. Strongyloiditis, on the other hand, is caused by Strongyloides stercoralis. For now, Strongy, its nickname, is known for its special abilities of hyperinfection and parthenogenesis. Often, it affects those that are immunocompromised, malnourished, or status post-organ transplant. Communicability is forever, for as long as the larvae are in the stools. The filariform larva penetrate the human skin and it traverses it with a very fast rate, where it is known as larva currents. After some time, it enters into the circulation and travels into the lungs, causing respiratory symptoms or Loeffler's-like syndrome. After being coughed up and swallowed back again, the larvae will travel into the small intestines and grow into adults. During this time, the following symptoms are expected. Only females exist and reproduce both by parthenogenesis and laying eggs containing already mature larvae into the intestinal lumen. These hatch into rhabditiform then filariform larvae all within the intestines. And the larvae repenetrate the human host via the rectal or perianal areas. This illustration shows the skin tracts of the larva of the Strongyloides stercoralis. Often, when we see this lesion on one site, after just a few hours, this lesion begins to disappear or is already gone because of the fast movement of the larva. Strongyloides is detected by looking for the larvae not in the skin, but in stool and duodenal fluid. Sometimes we might need to use an entero test or an enteric string test. Immunological options for diagnosis are available in advanced institutions. We are quite happy that this type of infection is not very common in the Philippines because the drug of choice is actually ivermectin, which in most drugstores is available in its veterinary version. Alternatives that can be used that are readily available include our albendazole and occasionally the thiabendazole. The treatment for this is much longer than the typical organisms we've already studied. It requires 3 consecutive days and often 10 days and in repeated courses in cases of diagnosed hyperinfection. So think of the strongy as the strong woman. Only the women or female worms inhabit the small intestines and are capable of parthenogenesis and are even capable of potentially killing their patients with a hyperinfection syndrome, and if mild, these patients can be infected for as long as 30 years. So remember that Strongy's drug of choice is the hard-to-find ivermectin, but albendazole can be an alternative, and we can't emphasize it enough that wash and food protection are essential. Basic, but life-saving. Oh wow! We've finished 5 organisms so far. Give yourselves a pat on the back. Good job!